Well, let me mention I'm Gene Dorio. I've been a physician here in Santa Clarita for 28 years. I've been a doctor for 34 years, and probably toward the end of my time now, but as Alan said in the very beginning, there's a lot of excitement when I come here and talk, and I think it more follows me than anything else, only because I'm not trying to bring it to myself, but I think, just as Judy said, things are a little bit too complicated, and that's the paperwork part. When it comes to the hospital part, think about this. You're supposed to follow that paperwork, bring yourself into the hospital, and still understand everything that's going on from paperwork in the hospital setting. So I'm going to try to clarify some of that for you tonight. Since I don't have a good sense of humor, I try to bring my humor with me, and every day I read the comics just to bring my spirits up, because I know I'm going to end up going to the hospital that day, and I need that. Get plenty of water. Why, doctor? You're a little pale. What to expect during your hospital stay. I'm a geriatric internist. I practice palliative care and hospice care. I do house calls here in the Santa Clarita Valley. I also have a radio show that was this morning. Been doing that for over, I think, 11 years now on your hometown station, AM 1220, KHTS. It's on Wednesdays. And I do now have a website. It started about a year ago. Nobody reads it, but I do send out emails, and don't get too many comments either. But this is probably some of the excitement that Al was talking about, because these are controversial issues that all of us are relating to, and you have to heed this. If you don't heed this now, in the future you'll have no understanding of what's going on, because it is getting worse. So when we talk about a hospital, you are given choices in actuality. You can be admitted electively, and that's usually if you have some surgical procedure like knee surgery and it's outpatient. You come in and you get your you can pretty much choose your hospital, but then the other side is when it's emergent and you don't have much choice as elective. Usually your choice is based on proximity, the reputation of the hospital, which is usually word of mouth, Yelp or internet, your doctor, and also your insurance plan. Emergently, though, if you get ill, you have to go wherever they take you. So if you are here in Santa Clarita, you'll go to Henry Mayo. If they're full or have some other type of problem, you might get taken down to Holy Cross, or for kids especially, they might get helicoptered out of here too. So just remember that you don't at that point have a choice. They're just taking you to wherever you have to go. And even when you go, for some of you seniors, and most of my practice, almost all my practice are seniors, but realize that even though you're sick, you go to the hospital, it still doesn't mean that you're going to be admitted. There are people in the emergency room now with that big, thick book that Judy was talking about that tells them whether you can be admitted to the hospital. And you like to think that doctors have a say in this. They don't, not anymore. So when you go to the hospital, you're fearful, you're wondering, will I die? Am I going to suffer? What illness do I have? Is it curable? How long will it take to get better? How will my quality of life be affected? And will I end up in a nursing home? And you do have to remember that almost everybody that goes to the hospital, you're suffering. You're in there for a reason, and you are suffering. So, and that's one of the key points that I'll bring back later. Suffering is there. We cannot help that. We're trying to get you a little bit better, but you are suffering. But most people, they might suffer. We might make them better. Typically, 95% of the people that are admitted to the hospital get to go home. What to expect when you are admitted? Expect that you're going to have an IV. That's an intravenous line. They're going to pull out your arm, maybe pull out your leg. They're going to put an IV in you. It's not like you see on TV and the patient goes, stick it in, okay, that's fine. That doesn't work that way. It's painful. They might intubate you. That's when they put a tube in your throat and they are breathing for you. You might be naked and sometimes at their mercy, and then some of you might like that. That's fine. Catheters in your bladder, having a rectal tube, a bedpan, bedside commodes, sponge baths, cleaning by staff after urination or a bowel movement, and feeling drugged up all the time. Don't expect, as you already know, good food or to even sleep well in any hospital. When you go in, you need to have certain material, of course, that you have handy, your ID, your Social Security number, your Medicare number, your Medi-Cal number, a contact person, so that you can, just in case something happens to you, they can contact your family and everybody else, who your doctor is, whether you have allergies or not, and what your list of medication is. And you should try to maintain and keep that medication list up all the time. Also, nowadays there are clearly a lot of legal requirements, not requirements, they're legal documents that one should bring in if you have them. End of life typically, and we're talking mostly about Medicare patients, but there's some in this room who are young, and even though you might still have this conversation, but especially when you're older, this conversation should take place now. It should not take place in the emergency room. It should not take place in the ICU. It should take place now. What you want, what you need taken care of, how you want your health care administered by your physician and the hospital, so we know far in advance. Also, if you have an advance directive, power of attorney, pulse, 5 wishes, DNR status, these are all documents. These are all documents that you should have when you come into the hospital. So my question to all of you, what is the most important thing to have when you are admitted? The most important thing upon admission that you should have. And we've talked about the cards and the list of medications. It's an advocate. You need to have an advocate. That's the most important thing. Somebody who knows you, friend, family, husband, wife, kids, or a legally designated power of attorney. And read the bottom part. This person will be your ears, eyes, and information center spokesperson. Questionnaire: should you not be medically able to understand or make decisions, you must have somebody in this role as much as possible. So, what can you do to optimize your comfort and care? Well, you're sick. You're not feeling well. And you don't watch TV, you don't play cards, you don't like earphones, and a lot of people just sit there and just wait for things to happen, and that's fine. But I just had a patient in the hospital, and she was a reporter for 30 years for a well-known national magazine, and also the editor of that magazine. And she had her yellow pad, and she's taking notes, and she's getting people's names, and she's making sure that she's going to make people accountable. Why? Because that's what she learned how to do as a reporter. So that's what I want our patients to do, and I tell them, all my patients, take notes, bring that yellow pad in, write down the time, date, nurses, doctors, people who come in, any of the ancillary care workers, get their names. Because once you write that name down, those people are watching you, those doctors are watching you. Get a business card from every doctor. I carry business cards all the time. And get the business card, but also find out which specialty they are, which part of their care they are giving you. You need to know that. You need to call them by their name and know exactly what they're doing. Know your diagnosis and what tests are being done to evaluate the problem. And ask your doctor about the time frame for possible discharge. The other things you can do is you can bring your cell phone, your iPad, your laptop, earphones, all the other things of comfort that you might have. Keep an eye on your dentures, glasses, and hearing aids, because that's what's lost all the time. Constantly in the hospital, patients are losing their teeth, losing their glasses, losing their hearing aids. It's a constant problem. It's left on the food tray. It's taken out in the linen. It happens all the time. You have to try to keep an eye on it if you can. If you have family members, and if it's possible, have them bring food in that you might like, that's your comfort food. And And the last one, the point is, don't be afraid to ask questions. When you don't ask questions, you're done. You have to be inquisitive. You have to make people accountable. Know your options for discharge planning, because that starts right at the beginning. Your options are you go home. You can go home now, and I do house calls, and I have patients who leave the hospital, they go home, and they get IV antibiotics at home. Plus, we have Medicare pays for nursing. And I know the other insurance companies pays for nursing. We have to get you qualified, but it does work, and it gets you home and gets you out of the hospital. And you can also go home. Another option is going to the home of a family member. We forget about that, but we always look to that as a possibility. Boarding cares, they're here in Santa Clarita. You know, I was told there are, I think, 100 of them, 100 boarding cares. Boarding cares are homes here in Santa Clarita. They might have 4 or 5 bedrooms. 1 or 2 people might live in a bedroom. They have 2 or 3 caregivers. It's very good care. My mother, who was hospitalized in West Los Angeles, and they did things, and I've written about it, so if you want to read about it, they did things to her where she, after her hospitalization, she couldn't get up. She couldn't walk. She's only 92. She lives at home. She takes care of her cats in her garden. But she couldn't get up and walk. And we had to bring her up here and put her in a boarding care. We did that for 3 weeks. And she was able to go home, and she's home now. In just a few days, we're going to celebrate her 94th birthday. You can go to assisted living. Those are Summerhill. They're building a new one, Oakmont. Sunrise, and there's another one, Capri, Pacifica. And then, of course, skilled nursing facility, nursing homes. And, you know, that's a whole different story. Everybody, you know, and right now, that's the whole push to get people into nursing homes. That's the way it is. And one thing down at the bottom I have, don't expect to leave the hospital feeling 100% normal. I look at it when you're about 70%, you can go home and make it at home. And so we try to, since I do house calls, I know how well people are doing, and I can make fairly good judgment whether people are going to make it or not. So, hospitals, they're a business. You are only a number. You have to remember that. That's happened not only at our hospital, it's happened at every hospital. It's a system that we're living in. That system, compared to other countries in the world, needs to change. Are we going to do that? Well, that's not in my back pocket. I don't know. But my hope is that as we sit here and we get to talk with politicians, that we will get some of the changes that are needed to make sure that it's not only a business, but it treats our patients with compassion and the dignity that they're supposed to have. They want you out of the hospital as fast as possible. That's their goal. They expect you to sign a lot of forms when you come in. I'm in the emergency room, and I see, you know, the people walking in with their little carts, and they're from admission, and they have a stack of paper. And nowadays they sign on a pad, or they sign this little other pad. I mean, and it's just a ton of things. And these people are ill; they're not feeling well, but here they're signing maybe their life away. Ask questions, but don't expect an answer. That happens all the time in the hospital because nobody knows how much things cost. This is just the way the system is. How much is that knee surgery? I don't know. How much is a doctor getting paid? I don't know. How much is that blood test? Nobody knows. It's just kind of wrapped up in there. We all know this now. You know, this is America. We should know what the price tag is on things. When you go home, take a look at your hospital bill. See how complicated it is. If you thought that your cell phone bill was difficult, these bills are outrageous. And now they're starting, if you can believe it, they're starting to charge a facility fee to go to the hospital and just be in the hospital. You know, I've seen that at hotels, but that's recreation. This is like charging you to be ill. It makes no sense. So the results of your tests were negative. Get lost. And that's pretty much what they're doing now. There's a nationwide push to get people out of the hospital or to put them on hospice, put them on palliative care, and then hospice care. They save money by doing that. If you are especially a Medicare patient, you get dumped right out. Ask the name of every medication and what it is because there are computer mistakes. I'm lucky because probably about 20% of my patients have memory problems, but the rest of them don't. And I will tell you that because they don't, and I've taught them to look at the medicines, even in a hospital setting, too many times they have found an error or a mistake that could have been detrimental to them because the computers definitely are not perfect. And then here's the biggest problem. 95-year-old in the hospital, I walk into the room, no call light nearby. There's no way for that patient to reach and find. I've had one patient who can't see out of one eye. Couldn't find the call light. I couldn't even find it. You know, how does this patient who needs help, I got to go to the bathroom, you know, or I need a sip of water. How do they call? They can't. And to me, if you are the caregiver, if you're there helping your loved one, you make sure that call light is close by. When you're in the hospital, don't take any surveys. They're not supposed to give you a survey. It's happened at our hospital. Read my articles. I put it out there. I blew the whistle on them, but yet I still think they're doing it. If you can't go home and they want to discharge you from the hospital to a nursing home, ask them, what are the other options? Because don't just go along with the idea that you have to go to a skilled nursing facility. And when they say, if you don't leave right now, you're going to get charged. Well, you know, you have rights. This is still America. We have people fighting and dying for us, but we can't get our rights here. There is something wrong with that, and it just upsets me to the hilt that some of my patients are being told that they have to leave the hospital, and if they don't, they're going to pay. Nonsense. Not when they've been soldiers fighting for this country, not when they've been seniors who have led this nation. There's no way this is going to happen. There's other things as well that, you know, as we go through this that I can talk about that are just long-winded. One is observation status. This was invented by Medicare. I'm not going to go through this, but there's a difference. There's a observation status, which is 48 hours, and then there's inpatient. But you have to be very careful when you look at your bills because there's a big difference. If you don't have a supplement, you could be responsible for a lot of that bill. And then when you're being discharged, you need to make sure you understand what your medications were before you came in and the changes that were made afterwards. We use a computer system. Every hospital now is obligated to use computer systems. They are not yet good enough to be able to make a change for the patients to understand what is going on. I go home to their homes and I see the sheets that I have generated and other hands have touched it throughout the time that they have gone from discharge to home. And when I look at it and see what I generated, sometimes it's different. You have to be very careful. Make sure you bring it to your doctor, these sheets, so that they understand and you understand what the changes are in your medication. Plus, even though you think that your physician, your primary care physician in the office or the clinic knows that you've been in the hospital, they probably did not know. They probably did not know why. They probably did not know the medicines. So just be aware. Other people who are in the hospital now, at our hospital, many hospitals, when I started 35 years ago, we had PAs. They're well educated. They do a great job. We have nurse practitioners at our hospital now. They're great as well, but you know they weren't trained like PAs in a hospital setting. Nurse practitioners are great, but they really aren't trained well enough. Make sure if you get somebody, you get a physician's assistance. Hospitals have changed. People haven't. When you're navigating this road, it's mandatory that you don't go over a cliff. Any questions? Steve?
I'm actually afraid to ask you at this point because if they're pushing you out the door, but I don't know what the implications. I don't know how a doctor makes a determination whether you're within a 6-month window of your imminent demise. So,
good question.
Without putting you on the spot, I just
you will not. My typical answer in understanding what's going on right now, and I tell my patients, my initials are GRD, not GOD. There's no way for anyone to know how long someone is going to live. Now, when people, I'm a palliative and a hospice doctor. So when people are at end of life, and not everybody is going to live 120 years or longer than that, people die. Last year, I had 5 patients who all were women, all were in their 90s, and they died at home, in the comfort of their own home, with their family. None of them were on hospice, but I knew within 48 hours or so that they would pass away, called the family up, brought them in, and waited for the patient who was not suffering. None of them were suffering. They were not in pain. They were doing fine, but I knew they were going to pass away. That's what I bring to the table. I understand that. I've been doing it for years. Many other doctors understand that too. But business is business. Hospitals are hospitals who are business people. They are now taking what they call palliative care and hospital and hospice care and corrupting it into a way that is not good for our patients. And until the American people say, you can't do this anymore, hospitals, insurance companies, Medicare, all these people, until we say stop, we're going to be in trouble. That's the direction we are heading. We have to stand up. I don't know if we will, but I know Steve, Patty, there's so many people. I look around this room right now who stand up, but we all have to stand up together. And my hope is when we do that, they will stop. That's the difficult problem that we are facing right now. Thank you.
What a guy. What a guy.
Happy birthday.